steps, which are patient preparation, follow-up overview, measurements, episode, and diagnosis. So on measurement, I'll go to each and every measurement that's required when you're doing follow-up. So regular follow-up intervals depend on patient's general clinical status as per the doctor's recommendation. But then the recommended follow-up intervals are within 72 hours after implantation, 2 to 12 weeks post-implantation, and every 6 months for ICD stroke CRTDs, and every 12 months for CRTPs and pacemakers in general. So steps, patient preparation, you do patient interview, ECG, that is external and programmer, as shown here. Maybe can you see my cursor? Hello?
Yes.
Am I audible enough?
Yeah, you are audible enough. Yes.
Okay.
Please go on, please.
All right. Thank you. So you need to connect ECG, that is external ECG, and programmer ECG, inspection of the implantation site, and device interrogation. So steps on follow-up overview. So when you do the interrogation for a CRTD, this is the screen that comes, and it has the follow-up. Yeah, but then there are things that you need to look at. So we start with the screen up here, labeled 1, which is the ECG, IEGM, and markers. So you have to make sure that your atrial activity is before the ventricular activity. So to be sure that you're capturing the atrium and you're also capturing the ventricles. Then check the last, our second point will be check the last implant and follow-up date, the implant and last follow-up date, which you find them here. So it will come with patient name, last follow-up, and then implanted date will be here. Then we check the status of battery and device. So device status, you check mode, which you'll find it here, mode, it's DDD, biventricular, basic rate, and also the battery information, you'll find it here. Then you go to episodes. So you can check your episodes that have been recorded, like the example of our screen here. It's 7 episodes, so you're able to actually click here and go to the episode that have been recorded, and you're able to make a decision before doing your tests. So our next step will be test results. These are sensing, pacing threshold, pacing impedance, and shock impedance for CRTDs and ICDs. So you need, our devices automatically do on tests at around midnight. So you're able, even when you do your test manually, you're able to check if whatever results you are getting tally with the results that were done overnight. Then on diagnostics, that is, pacing percentage in the RA, biventricular, or CRT. And then there is atrial arrhythmia burden will be there. So on measurements, we look at impedance test. So when you look at this screen, I hope you can see my cursor. And look at this screen, there's follow-up, parameters, and then tests. So after you have checked your follow-up screen, which is this one, and it varies from one device to another, but then that's just the basic interface, how it will be, how it will present itself. So you come to tests for you to be able to do. We start with the impedance tests. You just click here, start, and it will do the test automatically. And For impedance test, we know our impedance should not be above 2000, and it should not be very low as 200. Yeah. And then the shock impedance should not be above 150. That means if it's delivering shock, like the lead is intact, both to the skin and to the correctly connected to the device. So that's what means with shock impedance. Then we go to our sensing tests, where we look at our P wave amplitude, R wave, and LV wave. So you do your tests here. You just click start, and it will automatically do the tests. Same to the impedance test. But then the basic rate for sensing should be 30. So you get your results here for the P wave, R wave, and LV, which we all know that P wave should be above 1.5 to, and then R wave should be above 5 them to LV. Then the most important thing is to do pacing threshold. So normally we usually want our pacing threshold to be as low as below less than 1.0, but anything below 2 is acceptable. And also you need to look at the trend of, you know, uh, of your pacing threshold, so that we can be able to know if the lead has moved at any time or it hasn't moved. So for you to do pacing threshold, there is automatic and manual pacing threshold. So the automatic one helps us to set the capture control, which I'll show you later. But then let's go for manual, because sometimes it's difficult to do manual threshold. And most of the people, they know how to do it automatically, but difficult to do manually. So you just click here the mode if you want to test your RV or RA, and in which mode. Is it RV DDD, RV VVI? So able to determine from here. And then you put your basic rate and AV delay. So you have put our details here, and then we start. You'll have to click start here where the stop is, and then you can start like from 2. As you look at this screen, there is a pacing spike and then the QRS. So when you look at this pacing spike, QRS, pacing spike, QRS, that means it's captured even at 1 pacing spike QRS. But then over here at 0.9, we lost. So it was pacing spike, then there was some space there, then the QRS. So we lost capture there. So our threshold will be 1.0. And then we got to LV vector optimization, whereby you can choose to do the set LV, but then you can actually do for our QP technology that we are currently using. So we're able to have up to 20 vectors. So you can able to do the 20 vectors in less than 3 minutes. So you can choose to do manually or automatically. Okay. So what's the LV vector optimization? What is it for? To find the most suitable LV vector to optimize CRT, help for the second LV vector selection for multiple pacing, manage phrenic nerve stimulation. So when I look at this image over here, sometimes you find that where we put our LV lead is close to the phrenic nerve. So the QP technology, the quadrupolar lead technology, is able to help you to avoid phrenic nerve stimulation by choosing different LV vectors. Then our next step after checking your pacing threshold, then you go to episode. So you're able to review episode and maybe potentially do reprogramming. So when you look at this screen, I'll go back to the first screen where I showed you that you can be able to look at your episodes in step 4. So for CRTDs or ICDs, you're able to see, is there shock delivered and is there a shock delivered? So you're able to judge whether to change the settings or to leave the device settings as they are. And then you go to diagnostic, which is down here on our follow-up screen. So basically, our follow-up screen can take you to diagnostics and even recordings. So diagnostic is where it's here. So it will take you directly there. And recordings, it's here on episode, which was our step 4. So you're able to go there easily. So you're able to, under diagnostics, you're able to look at the percentage, pacing percentage in the RA, RV, and CRT, and even by ventricular. So you're able to judge whether to change your settings according to the pacing percentage. If the pacing, CRT pacing is less than 98%, then we need to look for potential reason why we are not getting proper CRT optimization. So some of the reasons that will be atrial arrhythmia with fast conduction, the AV delay is too long, UTR too low, trigger not on, which is here. So you're able to judge from there whether to change your settings. And then let's go to CRTP interface. So this is our most common used device here in Kenya, an ITRA 8HFTQP. So this is the interface when you go to parameters. So you're able to choose your modes from here, and then the pacing polarity from here, and also the ventricular pacing and AV delay. So when I go to all modes and the all modes are here, which I had shown you, you can just click here and go to all modes. So those are all the modes found in our device. And then another thing I wanted to touch on is the MRI programming, because most of the people do not know how to do MRI programming, and it's a very easy thing to do. So you just go to MRI, and also you can find this in the follow-up screen. The MRI, it's here. So you just click at the MRI tab and it will take you to here. So what do you do when you have a patient for MRI programming? Normally you have to do all the tests to check for the test results. So that is the sensing amplitude, pacing threshold, pacing impedance, and shocking impedance for CRTDs and ICDs. So you need to make sure that before the patient goes to the MRI, the pacing thresholds are okay. And after the patient has done the MRI, it's good to do interrogation and also check the same results to see if there is any big change or they're the same. So our device, Anitra 8HFTQP, it actually has auto MRI program that you can actually set for your patient. If the patient is going to do an MRI tomorrow, and maybe the patient has come to see you today, you don't have to send the patient the patient doesn't have to come back to you again tomorrow, as you may have a lot of patients to see. So you just do the MRI programming, and then you put the expiration date as indicated there on the screen, and then the MRI mode and basic rate. And then you have to put the device in bipolar, because when you go to MRI field, there is a radio frequency which brings about interference with pacing if the patient is in unipolar. But then you have to click this part here to say patient is approved for MRI scan, and then you click program. So I don't know if you guys have question for me. Hello?
Hello, William. Anyone want to ask any question?
Yeah.
So, okay, I think we'll end now, and